I'm going to talk about this because there are some very strong words from Sir Keir Starmer, who says that the NHS will not survive another 5 years under the Conservative Party. Starmer promised that Labour would make the NHS fit for the future if they won the next general election. He said they'd set new targets for ambulance response times, cancer diagnosis, cutting deaths from cardiovascular disease as well. And I'm very pleased to be joined now by the Shadow Health Secretary Wes Streeting. Wes, thank you very much. Great to have you on the show. When I look at some of the language that's been used by Keir Starmer here about bringing care closer to home, for example, we've heard about giving the patients more control. This is exactly the same language, with respect, Wes, that we have heard now for years from anyone who's remotely close to the NHS. What's different?
Yeah, I mean, I can understand why after years of broken promises from the Conservatives, people are cynical. That's why the plan today that Keir set out is really important, because even if the NHS weren't in the biggest crisis in its history, which it is, even if the public finances weren't in the mess which they are, the NHS would still need to change in order to meet the needs of Britain today and into the future, not Britain as it was back in 1948 when the NHS was founded. And that needs three big shifts, from a focus on hospital care to better community services, whether that's general practice, access to pharmacy, new mental health hubs Labour's committed to, or indeed supporting people's homes, which we'd support through greater investment in district nursing. We also need a shift from analogue to digital. We've got amazing life sciences and technology in this country which can offer groundbreaking changes in the way that we treat, diagnose, prevent illness. And thirdly, we've got to do better in terms of the health of the nation and tackling the grotesque inequalities that means that people can die almost 2 decades earlier if they're from a poorer part of the north of England than if they're in a wealthier, leafier part of the southeast. And that just can't be right in today's day and age.
How do you pay for this?
Well, we've committed to the biggest expansion of NHS staff in history, funded by abolishing the non-dom tax status. Right. And as Keir said today, the NHS does require investment, but also reform. And we're being so careful and cautious as a party in terms of the promises we make, because we know that people out there are really cynical about pledges and promises and whether they can be afforded. That's why any pledge we make, we say how much it will cost, where it will come from, and when people...
I get that, Wes, but a lot of people... Yeah, I do understand that, but a lot of the time the answer to how much it will cost and where that money will come from is non-dom status. And you are, as far as I can tell, relying on abolishing the non-dom status to fund things in education, the health service, when it comes to things like green energy as well. How much will you make...
only two things. Two things.
That was three things.
Just two things, right? So abolishing the non-dom tax status raises just over £3 billion. 1.6 goes to the biggest expansion of NHS staff in history, and the rest goes to primary school breakfast clubs in every school so that kids start the day with hungry minds, not hungry bellies. That's it. That's where the non-dom money goes, and there are no other pledges funded from
no other pledges. Good, right, well, you've heard it. You have heard it here. Good, you've heard it here, because I've been. I do interview a lot of Labour people, and it does seem like everything is non-dominated. So I'm very pleased about this, Wes. Thank you very, very much. But look, can I ask? There was a little sneaky little line in what Keir Starmer was saying, which made me wonder: is he opening the door for some kind of replication of a foreign health service? There was a talk about looking internationally and seeing how other countries are doing it better than us. OK. What are those countries? What kind of systems are we talking about here? I couldn't help but wonder whether there was a little nudge in the direction of some form of privatisation, which, of course, one would imagine the Labour Party will be dedicated.
Oh, no, absolutely not. No, that's not the answer. And similarly, I mean, I know we sometimes get Conservatives saying maybe we should charge for NHS services. The problem with the NHS isn't that it's free at the point of use. That's what, like when I went through my kidney cancer a couple of years ago, the one thing I didn't have to worry about was the bill. And I would die in a ditch to save that precious principle of free at the point of use public service. That's really important. Where we are looking, whether it's at continental European countries who do a lot more in primary care and community services, they do a lot more scans and diagnostic work in the community, they've got much better primary care and general practice than we do, or whether it's looking at Singapore or Israel and what they're doing in terms of life sciences and technology. I don't think there's one kind of model out there that we can just sort of wholesale lift up and plant into the NHS. What there are areas of excellence and best practice in other parts of the world that deliver much better outcomes than we do here, and we want to learn from that. But the fundamental principles of the NHS, free at the point of use, as far as we're concerned, are untouchable, and that's what makes the NHS worth fighting for.
OK, all right. Presumably you will be giving a whopping great big pay rise to NHS workers to make it a more palatable working environment for them.
We'll do what we can when we can. I ask people to judge us on our record. When we were last in government, we actually delivered pay rises year after year and actually full pay restoration compared to what had happened under the Conservatives previously. But we were able to do that because we got the economy growing. And so I've got a lot of time for nurses and junior doctors and what they're saying about the pressure they feel in their pockets, as well as the pressures they're under in the workplace. And I'll do everything I can to sit down, negotiate with them, work with them, and do as much as we can, as fast as we can. But I have been honest with them, like when they've asked for things like the 35% pay rise or 19.5%, I've had to be honest and say, I wouldn't be able to deliver that overnight. I wish it were possible, but the public finances are in a mess, and I'm not going to lead you up the path before an election and then let you down after an election. So we are being careful about the promises we make. We're asking people to judge us on our record.
Can I just on that judging on your
make all the difference.
Yeah, on that judging on your record thing then, Wes, is it not slightly unfortunate for you that the NHS in Wales is run under a Labour government and that is absolutely on its knees?
I don't deny that right across the UK, in all four corners, Scotland, Wales, Northern Ireland and England, the NHS is in dire straits. A lot of that is because, frankly, for more than a decade, we had underinvestment with the Conservatives, and that does flow through to the choices that governments in different parts of the United Kingdom are able to make. I think a Labour government in Westminster would create a rising tide that would lift all ships, and we'll be able to work in partnership right across the UK to support health improvement in every part of the UK. Obviously, health is devolved to Wales and Scotland, Northern Ireland, but I think all of them would be better off under a Labour government. And, you know, the SNP hate to admit this, but they know they'd be better off under a Labour government, even if we wouldn't touch them with a barge pole.
OK, look, very quickly, because I'm going to get shouted at, and I know you've given us a bit of your time. I just wanted to clarify one thing, if that's all right. This non-dom thing, to the 1.6 billion that you're saying it would raise for our NHS, abolishing the non-dom status, what do you do a couple of years later when all of those non-doms have left this country entirely and they're not paying in anymore?
So I don't think that's going to be the case, and we based our assumptions not on our own research, but on independent research conducted by academics in London and in Warwick, and we're confident that this would generate the revenues that we need. And look, there's a very high-profile example of a non-dom in Number 10 who pays their taxes here now, but they didn't leave the country, and I don't think other non-doms would, because for all the challenges we've got in Britain, this is still a great place to live, a great place to work, and a great place to do business. It could be so much better, and that's at the heart of Labour's plans for Britain.